Well, hi everyone, this is Dr. Shoto with this week's video introduction to week number 3 of our course in the Theoretical Foundations of Teaching and Learning. And again, a very good week of discussion. This week's discussion focused primarily on the concepts of learning styles, learning theories, and the various theoretical frameworks that we've developed that describe education and describe the way that people learn and the most effective ways to teach. The only real feedback that I gave in class that was corrective in nature was this concept of behavioral learning and behavioral learning theories as opposed to cognitive. And several of you had mentioned your initial discussion responses that, well, to kind of paraphrase most of them, there was you had gone to schools where there was a sort of a strict behavioral learning style that was used, and or that it was a very traditional behavioral style, and that you were given a lot of tests and had to regurgitate and memorize information for a test. And that does not really describe behavioral. Behavioral really refers more to when we think of behavioral learning is like training somebody to do something, and training somebody to do something using a series of positive reinforcements or negative stimuli. And we don't really use behavioral too much, at least not directly in education, and certainly not in nursing education, unless we're trying to, as I pointed out in class, doing something like where we want to make sure that everybody makes it to clinical on time. And in order to make it to clinical on time, if you don't make it to clinical on time, you have a negative stimulus of you have to go home for the day and then come and make up the clinical day on another day because you missed report. Or if you're more than 5 minutes late to class, you're going to lose a certain number of percentage points for the class that day, and therefore the student learns behaviorally that if they make it to class on time, they're going to get those points. Or if a student comes to class every day on time, like they're supposed to, maybe there will be some extra points given at the end, and that would be considered a positive reinforcement. But all that really does is change behavior. It doesn't have anything to do with how well they do in class as far as critical thinking or memorization. So that's kind of the difference there, and it's kind of a fine difference, and I don't want to beat it up too much except to say that it's kind of like mixing metaphors. You want to make sure that when you're talking about the activities in class that are focused on, reading a book, memorizing, and then displaying that knowledge or displaying that memorization skill based on the results of a test, that may not be the best way to teach, and certainly not the most effective way at building critical thinking skills. But that's not behavioral, though. Although I think that a lot of you, when you had read the descriptions, had perceived it that way because you felt that if you didn't do well in school, or if you you had to work so hard in order to get that good grade, you saw that as being a behavioral process, and that's not really the point here. Also brought up some of the things brought up in the class were this concept of experiential learning. And this especially goes back to the writings of John Dewey, who talked a lot about experiential learning. And much research and most of the educational theories that are out there really talk a lot about the importance of experience and providing experiences. One of the ways of providing experiences that was discussed in class this week was simulation. No doubt some of you, many of you that are going to go into nursing education, many of you are going to get that start, or you're going to be oriented when you start your careers working on simulation, because that's really where a lot of the focus is going on right now. I know in the state of California, and I know it's common in other states, and I believe that it's now an accreditation and American Nurses Association and AACN standard, is that up to 25% of clinical time in a nursing program can be granted or provided through simulation means. That's actually a lot. And simulation is great because it allows the instructor to be able to control a clinical critical thinking environment. You can set up almost like an experiment. You can set up a scenario where the students have to work through and have to problem solve and come up with some critical decisions in a kind of a real life patient care situation, but not have to worry about too many of the outcomes. And the big challenge with simulation is making it feel really realistic. One thing that I think that we can all relate to is having to go through CPR training, where they bring out the Recessiani doll and everybody has to do the, 15 and 2 now, and we all kind of sort of like go through the motions. But if you've ever been in a real code situation, you know that that's not really what it's like at all. All that little simulation in a Code Blue can do is teach us the correct steps in the sequence. In high fidelity simulation, the scenarios that are set up can be very dynamic and can change based on a variety of circumstances. And all of those things can be controlled by the instructor. So the instructor has a high degree of direction in providing those simulation experiences that can make it a very rich experience. And so simulation is something that we'll be talking about again later in the course. But overall, a very good week of discussion. I expect that I should have the grading for the discussion questions done probably on Wednesday, and the papers, your week 2 papers on your philosophy of teaching, those should all be completed by the end of the week, or certainly by the weekend. So be looking for those. And then going on to week 3, the focus of this week's learning is going to be, you're going to be starting your teaching setting up, I got to go to it real quick. I want to make sure that I'm reading it correctly here. Starting your teaching plan. Those are going to be due in week number 4. So please look at the rubric, look at the syllabus. Remember, the rubrics are included in the syllabus itself. You have to download the syllabus document now. We no longer have individual links to the rubrics separately like we used to in the classes. Everything is included in that syllabus document. So that's where you have to go to find the rubric for each assignment. And the discussion question for this week is going to be focusing on objectives and goals and objectives, and understanding the correct verbiage and understanding how to identify appropriate objectives for a particular learning outcome or for a particular learning goal. So that is going to be the focus of this week's discussion. As always, I look forward to participating in class along with you. As you have any questions, go ahead and let me know. I hope everybody has a great week. I hope it's not too hot and uncomfortable where you're at. In Southern California, we've had extreme heat down here recently. It's 109 degrees here in San Bernardino this last week. I was in Rosarito Beach earlier this week, and it was rather nice, 73 degrees. I kind of like that better. It's been hot and humid out here. So, but anyway, everybody have a great week. Let me know if you have questions, and I look forward to seeing you in the discussion forums.